In this video, we'll take a quick look at life as an RMO doctor in the UK. If you do decide to join our program, you will be joining us as an RMO, which stands for Resident Medical Officer. A resident medical officer is a doctor that is situated in a hospital and resides in a hospital for a period of time before leaving or breaking off for a short break. Resident medical officers are regarded at the level of an FY2 or SHO level. Life as an RMO can be interesting, while at the same time can be quite fulfilling. The schedule of an RMO doctor working for the NAS full-time is made up of 2 particular weeks. You've got a week on and a week off. On a typical day, you'll be working in an orthopedic specialist hospital where you'll be seeing patients that are post-op for elective surgery for cases such as a knee replacement, hip replacement, ankle replacement, and also minor general procedures such as inguinal hernia repair. Most of these patients are relatively stable and relatively in good health. You also notice that the only reason that most of these patients do come to our private healthcare facilities is to have these procedures done at a quicker rate, as opposed to waiting on a waiting list. On a day-to-day basis, on a typical day, your day will start by checking for any jobs that have to be done on the wards. So, unlike in a typical working environment where you'd have to do a ward round, most of the RMO jobs do not require that you do a ward round. Each of the hospitals where the RMOs work have got an RMO room, and you find that you spend most of your day in the RMO room. The good thing is these RMO rooms have got good facilities, have got showers, television, and in most cases have a small fridge and good internet connection. If needed, the nurses on the wards will be able to bleep you or call you to your telephone in your room, and you'll be required to do 1 or 2 jobs on the wards. So how busy is RMO work? So on a typical day, you would have a busy morning and afternoon, but the days normally tend to slow down as day proceeds. When you wake up in the morning, your first jobs will be to do any bloods on the wards for patients that are post-operative and in some cases pre-operative. After doing some bloods, you may be required to prescribe some painkillers for patients that are post-op. Following the patient's surgery, you will be required to prescribe patients' own medications, such as BP medications and insulin or metformin. Occasionally, you might be called to the CT scanner or the MRI scanner to insert a cannula in patients if the staff in that department are having a challenge. A typical ward that an RMO covers usually has about 50 patients. Most of these patients do not have to be seen for any medical problems, but might require that their own medications be prescribed as earlier mentioned. In 1 or 2 cases, these patients might have minor post-op complications such as a low BP and increased pain, and will have to be seen by the RMO by taking a history, assessing the patient, and then speaking to the consultants to let them know exactly what's going on. It's also important to note that in the RMO jobs, you will not be required to make any major decisions, but will have to go through your consultants to make any decisions concerning the patients. If there are any medical problems arising from any of the patients, you might have to speak to the anesthetist who will be able to assist with advice on what to do next. On the days post the surgery, you might be required to do post-op bloods for the patients, and also to follow up these bloods and ensure that all the bloods are within the normal parameters. Once in a while, you do get a patient that's coming for a surgical procedure that falls ill, and it will be up to you to assess this patient, take a history, do an examination, and communicate to your seniors. In general, working as an RMO is a relatively fulfilling and safe job. You hardly encounter a lot of complications in the patients that you see because most of them are screened pre-elective. in the pre-surgical screening department. Once in a while, you might be asked to see patients in the pre-surgery department where they're being screened to take a look at ECGs and also see what you think about the ECGs or any possible complications or any issues that might complicate the surgery. In most of those cases, if you do feel like you're not comfortable with making an assessment, you can communicate with the anesthetist who will be able to help. Generally, you work in a 1 week on, 1 week off type of model. So you come in on Monday at midday and you leave the following Monday at midday and work the whole day, every single day for the whole week. The good thing with the schedule is that it gives you a whole week off. And also, you also find that it's rare that you actually need to be up at night seeing patients. In a typical week, you might be woken up 1 to 2 days in a week just to see a patient that's had a bit of a post-op bleed or a bit of a post-op pain, and you might have to actually speak to the consultant about that. This is, however, not very common. On your weeks off, you're free to do whatever you wish. If you would want to take up extra work, you can take up extra work, mainly with the NHS through locums. Most people, however, prefer to rest at least 1 or 2 of those days and then probably travel to destinations of their preference just to explore a bit of the UK and see exactly what the UK has to offer. By the end of the 1 year that you'd have worked with the NES, you'll find that you'd have learned so much from the RMO jobs, which would be very valuable in any of the training programs that you do choose in the future. In addition, the RMO is a very good road to come into the UK just to see what the UK has to offer, because you can work as an RMO full-time while still working the NHS for locums.